pulled up in the Crowbar Hotel. That's the recreational stuff. Now, medicinal marijuana, obviously, is something that we've initially spoken of. I think there are a lot of folks for whom this has become a real salvation. In other words, they've had depression, anxiety, sleep disorders, and I hear more often than not people speaking of the impact of medicinal marijuana being a godsend. I wanted to pick up on that as a point going forward and see where we stand. As far as pharmaceuticals are concerned, maybe they will replace pharmaceuticals, and there could be a fight on our hands with the pharmaceutical industry. Joining me on the line is Dr. Michael Verbora. He's a medicinal cannabis expert, a prof at McMaster University. He's also the CMO of Canada's leading medicinal cannabis company, Aleafia Health. Dr. Verbora, it's good to have you here on the Oakley Show. Good afternoon.
Good afternoon. Thank you for having me.
All right. And so medicinal marijuana has been known to be, I guess, a salvation for many. Is that your experience as well? People from suffering from anxiety, depression, PTSD, et cetera, et cetera?
So from my lens, I've been prescribing for the past 3 years. And I have seen over and over now hundreds, if not thousands of cases where patients are doing exceptionally well. And I think it's a combination of not only the medical cannabis, but it's also looking at the other pharmaceuticals that may at one point have helped, but are actually causing more side effects and problems. And so when we substitute with medical cannabis, we're starting to see many patients have an improved quality of life, and for example, getting back to work.
All right, but do you see there could be a conflict here? Pharmaceuticals may just be displaced by medical marijuana. They won't go quietly, will they?
No, I don't anticipate they will, but I do anticipate that with time, as we develop more research and evidence in this space for the various conditions that patients are medicating with, I do anticipate that more pharmaceutical-grade products will be generated from the space. The big debate is, in the medical community is whether the pharma approach of isolating ingredients and picking just one chemical out of the flower is going to work. Many people in the space feel that you need the entire plant or flower with all the ingredients to replicate the medical effects. So we'll have to see what the research bears, but I do expect more research in pharmaceuticals to enter the space.
There was research out of BC recently, I believe, the Center for Substance Abuse out there, or use, and it shows that Canadians with PTSD, this is an article in the Globe and Mail from a couple of weeks ago, Canadians with PTSD who use medicinal cannabis are 60 to 65% less likely to have major depressive episodes or thoughts of suicide compared with those who do not treat their symptoms with medical marijuana. That speaks glowingly of the medicinal compounds of marijuana treating PTSD, doesn't it?
Absolutely. In my experience, PTSD is an extremely severe form of anxiety, and the treatments that we have with pharmaceuticals don't typically alleviate the symptoms that these patients have. And at Aleafia, we focus on first responders as one of our areas that we are focused on, hyper-focused on in terms of helping. And through our clinics, we've helped thousands of patients with PTSD have better quality sleep and reduce the anxiety that they experience.
All right, but they go on to say that marijuana is not necessarily the cure, it's just a good option. Would you agree?
Yes, I think without doubt cannabis is a medicine that patients use, but it has to be used in conjunction with other lifestyle measures.
How many medical marijuana users are there in Canada right now?
So the last projections were somewhere between 250,000 to 300,000 medical cannabis patients.
And how easy or difficult is it to get a prescription?
Well, at our clinics, we require a referral from the family doctor or the specialist, so that way we ensure that anything that we do in terms of a treatment plan with medical cannabis is communicated to the team, because we want to ensure that the entire healthcare picture is well integrated for our patients. I can't say what happens at other clinics, but by and large, we're just seeing more and more cases of patients doing well, and what started as extremely conservative prescribing and very few doctors prescribing and very few patients having access, over the past, let's say, 3 to 5 years, we've seen exponentially more doctors prescribe, now close to 10,000 across Canada, and now hundreds of thousands of patients using it because they are getting benefit.
Well, some people say it's almost too easy to write a script or get one from a doctor. How would you reply?
Well, my concern as a physician is the opposite. It's been too easy to get a prescription for opiates, and unfortunately, that's led to a crisis that many physicians on the front line feel like they have to tackle. And I'm one of those doctors, and I'm committed with our organization to help fight the opiate crisis, and cannabis is one of those tools.
So what you're saying is it would not be seen as a gateway, whereas some people have actually made that point. They think it's a gateway to maybe opioid use or something else, some stronger drugs.
In my experience, cannabis has been an exit drug for many of my patients who have been addicted or dependent to much more harmful substances such as opiates or benzodiazepines, which are highly addictive and have toxicity that can cause death. The reality is you can't die when you use medical cannabis, and that's a first step for helping patients.
When it comes to the legalization of recreational marijuana, and the producers have to supply that market, could it impinge on the supply that would be available to medicinal users?
I think that's a genuine concern. Many medical cannabis patients are concerned that some of the suppliers will jump to the recreational market and attempt to bulk sale their product. And you know, that's the reason why Aleafia Health Inc. Has been organized to be vertically integrated so that we can ensure that we secure supply and grow supply for our patients that need it, to ensure that there are the proper medicinal strains and that there is a medical market that is thriving so that patients can continue to do well.
And when it comes to the various strains, the quality control is being ensured by Health Canada?
Yes, there's a number of testing and reporting that is required, and at any time, Health Canada can also do inspections, and they can also test any single product for pesticides, and I would say the rigor is quite extensive and exhaustive that for many of the producers, and definitely on our end, that it's all pharmaceutical grade in terms of production and testing.
What's the regimen if somebody has they have the right to use medicinal marijuana, but going stateside? Again, I'm not familiar with the rules of engagement. You're allowed to travel and make that admission that you have a legitimate script?
Well, there's a lot of politics at play for my patients who are traveling the world. They find difficulties, whether it's going just stateside or traveling across the world. It's very difficult. I have children who use CBD oil for seizures, and they need it every single day. But crossing over to the United States or flying to India or another country poses a huge risk to them because they're not allowed to bring it with them. So it severely limits patients' ability to mobilize globally, and that's unfortunate. But that's going to change, I suspect, as more research and more evidence comes out, and globally we start looking at legalizing this.
Yeah, I was going to ask finally, the nexus between medicinal and legalized recreational pot. Do you foresee any problems, or will this all be somewhat seamless, integrated, and everybody will be better served?
So it looks like for the first 5 years, the government is committed to developing a robust medical program for patients, and we are heavily invested at Aleafia in focusing on the research and ensuring that we're providing the best evidence for patients and doing the right studies to show where it does work and where it may not work, as well as understanding the pros and the cons of the plant, as there are risks as well with the cannabis plant. I anticipate that things will go relatively smoothly, but I think you alluded to the problem that some providers may just jump ship and stop supplying medical patients, and that's a concern.
All right. Very interesting. We're obviously entering new territory here with the rollout of recreational pot. You guys have had the jump on it with medicinal cannabis for a couple of 3 years, I guess you're saying. We'll watch with interest and follow up. Thanks so much for your time.
Thanks for having me.